Hi there, my name is Augustine in Japan, and my index number is AHOPT 220008. And the course code is OPT 436. And my question is, can empathy be taught? Exploring the development of therapeutic skills. Before I answer the question, I want to explain what empathy actually is, because it's often confused with what sympathy. So sympathy means feeling for someone. Maybe the person has lost a brother or a loved one, and then you'll be like, oh, I'm very sorry you've lost what? Your brother. That's what sympathy. But empathy goes a step forward. Empathy means feeling with the person, being able to experience what the person actually going through from the inside out. And this feeling will help you, will guide you on how to offer care to the patient. So in healthcare practice, we have two types of empathy. There is the cognitive empathy, which deals with being able to recognize what someone is thinking, what the person is thinking or feeling. Basically, identifying what the emotional state of the person. And there's what? The affective empathy. So the affective empathy is the response that comes with what? Sharing the feeling with the person. Both of these two matter in healthcare practice. This is because the clinician must be able to what? Recognize the emotional state of the person, that's the cognitive aspect, and also be able to connect to the person to a level that the clinician will be able to offer warmth to to the patient. That's what the affective empathy. And then these two combine to form what you call the therapeutic relationship. That's the bond of trust that exists between the clinician and what the patient. So now the big question: can empathy be taught? Is empathy something you are born with or something you learn? The honest answer is both, because there are actually people who are born naturally and they lean towards others' emotions more than themselves. This may be due to the person's personality, but in clinical psychology, it's the empathy we're talking about is not fixed. It can actually grow, you can develop it, and then it's what? It can strengthen over time. How does this happen? Let's dive into it. Firstly, education plays a huge role in the development of empathy. Courses on psychology and medical ethics introduce students to empathy languages, how to recognize emotional cues, how to respond without judgment, and how to communicate in a way that makes the patient feel heard. Secondly, clinical training is where theory meets real life, where students interact with real patients under supervision. They begin to see first-hand training on how body language and communication affect someone who is anxious, scared, or in pain. And the third one is reflective practice. This is something a lot of healthcare programs now indulge in their curriculum. This involves taking the time back after every patient interaction to ask yourself, how did it go? Is the patient comfortable? This self-reflection helps turn experience into real growth. Fourthly, patient interactions are powerful teachers. The more conversation you have with different people from different backgrounds, ages, and circumstances helps to broaden your overall perspective, and this helps to increase your empathy naturally. Finally, a professional experience tends to deepen empathy over time, although there are some studies that empathy tends to decline during training when students experience fatigue. In as much as the training also important, your self-care also what matters. So yes, empathy can be taught. You just need intention, practice, and the right environment to nurture it. Now, let's talk about the clinical relevance of empathy. When a patient knows that the clinician actually understand him and knows what he's going through, the patient is more likely to trust the clinician. And trust is everything. When the patient trusts you, the patient is more likely to open up and be honest about their symptoms, more likely to ask questions and follow treatment plan, something we call treatment adherence. Empathy also improves patient satisfaction. Think about it. With the same diagnosis, let's say glaucoma, how a clinician might give the information to the patient will differ from another clinician who doesn't have empathy on the patient. That clinician might just give the raw diagnosis without having any emotional backing, and ultimately it all feeds down to a better health outcome. Now let's bring this to life with an example. Let's take the eye care for instance. Imagine a patient comes to your clinic for the first time for a routine checkup, and the person is told that he or she should start wearing glasses for the first time, or even worse, diagnosed of glaucoma. Most patients, especially the adults, will bring out fear of losing their vision and their independence. An optometrist who just pours down the clinical facts and moves on might leave the patient anxious and worried. But the other one, who pause for a moment and notice the patient's hesitation and explain the diagnosis in plain words for the patient and reassures the patient of what the diagnosis is actually about and what can be done about it, builds trust immediately. This trust helps the patient to follow the treatment plan and also come back for routine checkup on the diagnosis as well. In conclusion, whilst other people are born naturally with empathy, it is a skill that can be learned and cultivated through education, clinical practice, and real world experience.